Welcome to the World of Rare Disease, a show that focuses on awareness and education about rare and complex disorders. My name is Lisa Deck, and I'm a Rare New England committee member and your host for today's show. Today, our show features Richard Pezzillo, the Executive Director of the New England Hemophilia Association. Rich has led NEHA for the past 3 years and considers it an honor to work for an organization that is mission-driven and constantly changing lives. The New England Hemophilia Association has been a lifeline and support for families with bleeding disorders for over 6 decades, including his own. Today, we will learn more about hemophilia and the role it played in Richard's personal and professional life. We're thrilled to welcome you to our show, Rich.
Great. It's so great to be here. Thank you.
Excellent. Let's start at the beginning. What is hemophilia or a blood disorder?
Sure, it's a great question. So hemophilia is a rare condition. According to the CDC, it affects about 20,000 people nationwide. In New England, it's estimated that there's about 1,500 people living with hemophilia. There are multiple other types of blood disorders, but we'll focus on hemophilia. So many people think that a person with hemophilia bleeds faster. In reality, they bleed longer. And the reason why is they're missing a clotting protein inside of their liver. So if you can picture dominoes falling on top of each other, someone with hemophilia A is missing that 8th domino, someone with hemophilia B is missing that 9th domino. So when the dominoes fall, there's one missing, what happens? The rest doesn't actually collapse. So to help fill that missing clotting protein, patients have to take on a prophylactic basis or on demand an infusion through IV, or now we're very thankful that we have a subcutaneous injection too. So really the misconceptions is that patients with hemophilia bleed not faster but longer, and they're missing a clotting protein.
Okay. So can you tell me how that has affected your personal life?
Yeah, so I have hemophilia myself. It's been in my family, so 30% of patients, there's no reason why they have this condition. For the other 70%, it's a genetic condition. So my grandfather had it, my mom's a carrier, it's on the X chromosome, and my mom had 3 boys. 2 of us have it, 1 does not have it. So personally, living with hemophilia, I would say that growing up, I was always considered the bubble boy, taken out of sports, being told that you bruise easily, always being careful. I can remember at age 5, I convinced my parents that I wanted to play t-ball, like most boys and girls, getting involved in sports. And I played 3 games, had a helmet on, got hit in the head. I was fine, but it sent the red flags up of, is this the right method of someone with hemophilia to partake in? Right. So I would say a lot of it I bruised really easy growing up. I was taken out of, any contact sports and gym classes. I was always the person that walked around, the laps in gym around the gymnasium or outside. But I would say that, a lot of it had to do with being aware of communicating with my parents and my healthcare providers and making sure that when we did have a bleed, what to do. And I think the word a bleed to those outside of this community may have a question mark. So it's not gushing blood. Many people ask, what happens when I shave? And it does stop bleeding, but bleeds are joint bleeds, stomach bleeds, head bleeds inside of the organs that could really be either life-threatening or can cause permanent damage when you have them inside of a joint.
Right. And were you diagnosed soon after you were born?
Yeah, so I was diagnosed at age 2.
Okay.
Most patients are diagnosed at birth.
Okay.
Usually when circumcision is the major red flag that it won't stop bleeding. A lot of patients, especially for C-sections, when they use a suction to get the baby out, can cause a head trauma or a head bleed.
Right.
But I was actually diagnosed at age 2 when my brother had problems after he was born. Okay. They had said, well, he has it. Your brother's 2 years older, he's full of bruises, let's also test him.
Right, that makes sense. So I know with a diagnosis like that, you were 2, so you can't necessarily remember that, but in your life, how did you embrace the diagnosis and how did you fight it?
Yeah, so I think it's a great question. Growing up, I was in denial. I thought as far as I could think back, that this is a burden. Why do I have to be different? I have this condition, and you can't see it physically, but there were so many things that you had to do. As I got older, it didn't get easier, it actually got harder. So 30% of patients also are not only spontaneous in terms of that mutation, but form inhibitors. So an inhibitor is an autoimmune response to the clotting protein that goes inside of your body.
Gosh.
So what that means is I'm giving myself this clotting protein to actually keep my levels high enough so I'm not bleeding, and now it's an autoimmune response that's not recognize it. So at age 18, I formed this autoimmune response. I was going to school up in Vermont, and as you can imagine, most 18-year-olds think that they're invincible. It's your first time away from home. You're living on your own, figuring out how to do laundry and eat on your own and manage your own time. And that's when the inhibitor kicked in. So it was difficult because as a young adult, I'm trying to manage college, but also this spontaneous bleeding. And that went from a very managed hemophilia to a complete unmanaged, where I started spontaneously bleeding. I would wake up in the middle of the night and my elbow would be completely swollen and it was full of blood, and there was no reason for it. There was no trauma. So to treat that it's called immune tolerance therapy, where you overwhelm your body with a large amount of factor to hopefully suppress the immune system. So we often explain to kids about this like Pac-Man or Pac-Woman. They eat and eat and eat, and hopefully they eat so much, like on Thanksgiving, they're going to fall asleep. So what I had to do is I had ports at the time at age 18, which I didn't have growing up. And I had to learn how to do this daily. So I was doing a 60 cc syringe, which is a pretty large volume, twice a day. And then what that did is, because the medicine has to go through IVs, at the time there was no sub-Q injection. So you're putting a tourniquet on, finding an IV is when the port came in. So I've had a total of 3 ports, 2 central lines called PICC lines that had to come in and out. So I would say my personal situation is it got harder as I got older. I also have moderate hemophilia. So the different levels is severe is you have less than 1% of that clotting factor. Moderate is 2% to 5%. Mild is 5% to 50. Anything over 50% is considered normal. So if you don't have hemophilia, that 8th clotting factor, if you have over 50%, you don't have hemophilia. So for a moderate patient, this is a typical story that they can go through without major treatment or without major bleeds. But when that inhibitor came into play is when my life completely changed, with the joint bleeds, the muscle bleeds, the internal bleeding, and then that prophylactic of infusing, sometimes 3 times a day.
Right. So are you now still in a situation where you're doing all of that? Is that still your daily life, or has that changed?
Yeah, so thankfully after about 5-6 years on immune tolerance therapy, the inhibitor did decrease. So once the inhibitor kind of decreases, you go back into some sort of normalcy pattern. So right now I still do an IV infusion every other day at 2,000 units. So I still put a tourniquet on, find a vein. I don't have a port anymore. I don't have a PICC line. But that's one of the beauties of this condition, if you can look at the silver lining, is independence. You do not, I think when many people think of an IV infusion, they think of a person taking your blood or a phlebotomist.
Absolutely.
And ultimately that's what we're teaching patients, and sometimes kids as early as 6-7 years old, that you have to find, you need to know your vein patterns. You need to know where they are. And they're scarring in certain areas, but you can figure out where they can go. So infusing now is like brushing my teeth. I don't think of it anymore. Do I enjoy it? Absolutely not. But I know that it gives me the levels that I could do things and not worry about, God forbid, I get into a car accident or I fall, doing normal activities or bump into something, that my levels will be high enough.
Right. It's interesting because in my early 20s, I had PICC lines and different things, and I fought the port for a long time. And I look back, I don't know why I did that, because there was definitely, it's difficult to do that. So wow, that is quite a story. And I think, thank you for sharing it, because I think you sharing your story is giving voice to those who are not sitting here with me. You're explaining what is a life like when you have a bleeding disorder. And so I think that's really informational and inspirational too, just to know that you can live a normal life and that you can figure out how to do it. And I love the independence piece. What brought you to NEHA? How did you transition there?
Yeah, so NEHA has always been a part of our family. The organization's been around since 1957, as you mentioned, over 6 decades old. So with my grandfather having hemophilia, NEHA was part of our family dynamic. My story of like how I got there is, I think, very interesting of when you look at a career path. Again, going back to age 18, most at that age as a freshman in college, maybe are still mapping out where they want to be, or what, who do they want to be when they grow up. I always wanted to be a weatherman. Ever since I was a kid, I had a fascination with the weather. I still do, in terms of, I have notebooks upon notebooks of forecasting my own weather, putting my high and low precipitation, and then going back and looking at it. So I went to school up in Vermont to be a meteorologist. Due to what I shared with the inhibitor and the problems I had, there's only certain hospitals that could treat patients with rare conditions, as you know. So in New England, there's 9 federally funded hemophilia treatment centers. I was going to school in the Northeast Kingdom of Vermont, so Dartmouth-Hitchcock is about an hour and a half away, and they get a lot of snow up there. So in the winter, it's challenging to be seen at that center. So because of the health adversities I was facing, I was there for 3 years and ended up taking a year off and then switching to another school in Connecticut that has a meteorology program. So fast forward, I thought, well, I'll be, forecasting the weather, maybe, coming up with a new version of Twister and or being in Oklahoma or Texas. But getting involved in the bleeding disorder community when I was in college helped me to embrace that having a condition is that silver lining again. We always have heard the phrase half full, half empty, and how do you look at it? Do you as a patient always see it as half full? No. Do you always see it as half empty? No. But getting involved and having that community, be there as a support. So at the time there was a program called the National Youth Leadership Institute that was with the National Hemophilia Foundation. So I applied for it, I got in and was accepted as an early 20-year-old. And part of that program is training on a national level, and a lot had to do with advocacy. I think for any rare disease community, being present at your state house, knowing your elected officials, and especially in DC as well. So I went, as part of this once a year down to DC, shared my personal story, and the cost of hemophilia is so high. It's hundreds of thousands of dollars a year, if not close to $1 million for certain patients. And I shared my EOB, my explanation of benefits, with the Health LA, and that led to the senator doing a floor speech about hemophilia and using it as an example of high healthcare costs. After the floor speech happened, I was invited to do an internship if I was interested in DC, an unpaid internship, and I thought, well, this has nothing to do with what I went to school for. Should I do this? And I ended up doing it, and it opened up a door. After 3 months of doing the internship, I was offered a paid position. So I worked for a United States Senator for almost 4 years in the press office, and eventually became a press secretary. So that opened up a new career path. While I was in DC, I then got a job for the Hemophilia Federation of America as their marketing director. And then when I wanted to move back to New England, because this is where my roots are, the position became open, which I never thought I would run a nonprofit to help run the New England Hemophilia Association. And I've been doing that. It would be 4 years this April. So very interesting career path, but I tell you that whole story because I always tell, I had a conversation with a college kid yesterday, and he said, I don't know what I want to do. He has hemophilia. And I shared that story because you never know what doors may open. And I think especially when you have a chronic condition, open that door, embrace it, because it will continue to open doors, but it's not going to do it for you. You have to be proactive with that.
I love that advice. Interestingly enough, I remember, and I think we talked about this when we had our pre-interview, in my early 20s, I was asked to go down to DC to be an advocate, and I didn't even know what that meant. And here I am 20 years later still doing it. So again, I think doors open, take that step, do that. I think that's great advice. So I did have another question, and I think we do know that you have mentioned hemophilia is a benefit and a challenge. But what would you say is the greatest benefit it has been for you? Because looking from the outside, I can see a couple, but what speaks to you? What has been the greatest benefit, sadly, of having a chronic condition?
Yeah, I think it's an interesting question. I would say, if I can answer in two folds.
Absolutely.
The first is the connections that I have made personally. There are so many people that I have met from across the country that I would have never met before. You know, sometimes I take a seat back when we have educational meetings and I meet these new parents, and I think our paths would have never crossed, and they become friends. So I think the personal connections of the support of really a family that you have, this unintentional family, but a family that will stand by you. I met some of my closest friends have a bleeding disorder, again, from around the country. I also think that it has given me a sense of self. So in high school, actually middle school and high school, I had a really bad stuttering problem. So I was in speech pathology classes and a self-confidence issue. And I think because you have to learn to advocate for yourself in a hospital setting, when you have a rare condition, you have to learn to advocate for yourself. As you mentioned, with legislators, with insurance companies, all of us living with any chronic condition has to spend more time than we want with insurance companies. Something triggered to, inside of me where I don't know what happened, but that stuttering problem went away. And this is years of speech pathology classes. So I think of this as, an unexpected consequence of having a chronic condition has opened up a new way of self, of kind of looking at the world too. And, you echoed about independence. I think you grow up faster when you have a condition. I think kids, adults start seeing life a little bit more differently when you're in the hospital or tethered to a wheelchair or have to look at medication that you rely on. I think you have to grow up. Right. And I think it's that choice. So, I always looked at myself a little bit differently compared to other 18, 19, 25-year-olds and saying that I think I had to grow up faster. And I think that's what happens when you have a chronic condition. You are given this burden, but you also are giving this blessing in some way of having to, being forced, but also allowing yourself to kind of grow into that mold that, you have as living with a bleeding disorder.
Right. I love that perspective because I feel very similarly to you in that situation. So finally, advice to others who have it, and you kind of touched upon this, but is there any final words you would want to give to somebody dealing with a bleeding disorder, a chronic illness, a rare disease? Any advice for them?
Yeah, so our name is New England Hemophilia Association, and we talked a lot about hemophilia, but really hemophilia associations from across the country serve all types of bleeding disorders. Von Willebrand's disease, rare platelet disorders, factor 7, factor 13, all those in that domino effect that are super rare in terms of there could be 100, 200, 300 patients nationwide. So I would say that my advice to others is sometimes when you hear of a community or an organization like NEHA, there's hesitation of saying, well, I don't understand it. What does it mean to be an advocacy group? What does it mean to have a symposium? What does it mean to have a family camp? Is take a chance and get involved. You're not alone. So often we have patients that come through the door or give us a phone call and say we need help with insurance, and we encourage them to come to a meeting. And I think they quickly see that there's support, that there is an army of people. We kind of look at it like the Marines. You press the button, you can activate them. The same way with our community is, we have an array of people that have such incredible experiences. Our community in particular has an extremely devastating history with the bad blood era in the 1980s, where this clotting protein that I described that I give myself was plasma-based, and it was infected, unbeknownst to everyone, with HIV and hepatitis C. So we've lost over 10,000 members as a result. So I think when you think of resilience, this community is the epitome of that. And I mention that because that would be my advice, is that there are folks that are involved that have lost loved ones, that now the next generation are being born with hemophilia and kids, but they still have a sense of belonging, and they still have a sense of support that, just like an old friend, they don't have to come and be involved with everything, but they could pick up the phone and know that they're always invited and that they'll have that level of support.
Wonderful. Well, it sounds like you and the organization are providing such wonderful opportunity for people to get through their own situation and be a part of something. Push the button and there you go. I love that. I think that is our show for today. Thank you so much for being here. I really appreciate it.
Me.
Yeah, it's
wonderful.
wonderful.
It was a pleasure. Thank you.
Excellent. Before closing, we provide our viewers with an opportunity to share comments or ask questions from previous shows. Rare New England in Motion is the perfect way to expand upon our mission of engaging with our community. Please send us any questions or comments you have to info@rarenewengland.org. We will share your responses on our next show. We recently received a question from a viewer asking, how can I be an effective advocate? Thank you for this great question. The key to being an effective advocate is to be willing to speak up and share your personal story or experience with your legislators. There are various ways to do this. You can simply email your representative, place a call, use social media, or do an in-person visit. It's our privilege to influence public policy, and being a rare disease advocate is a great way to do that. Please reach out to Rare New England if you would like more information about that subject. If you have a question for Rare in Motion, please send it to us in email. We appreciate any inquiries. That's our show for today. From all of us at Rare New England and all the patients and families who keep rare disease in motion, thank you for watching. And remember, when you hear hoofbeats, think horses, and then think zebras. Thank you.